Hi everyone, my name's Diallo, and today I'm going to be teaching you about asthma. So, what is asthma? Asthma is a respiratory condition that affects your breathing. So, this occurs in the bronchial tubules of your lungs. This is where air travels before it goes into your bloodstream. Those tubules, they have muscle on there, and if the muscles constrict, they cause a lot of inflammation and tightness, which causes those tubules that has air to flow to shrink, which causes you to have shortness of breath, coughing, wheezing, and not getting proper oxygen into your bloodstream. 5 ways that CNAs can help patients with asthma will, 1, be making sure you check their vital signs and their respiratory rate. If you notice anything that's outside the normal range, report it to your nurse immediately. Also, knowing the position that your patient is in. If they're in a supine position, sometimes people who have asthma will have trouble breathing and will make respiratory conditions worse. So putting them in like a high Fowler position would definitely help as well. Another tip would be if your patient does physical therapy at all, making sure you check in with them to see if they're struggling with breathing or getting through any kind of exercise. With asthma, any kind of pushing physically will worsen the symptoms overall. Another key component would be what you hear when they are breathing. So using a stethoscope or even just hearing audibly, if you hear wheezing, if you hear gurgling, or them trying to constantly clear out mucus, that's a clear sign that they're having like an asthma attack or something is occurring within the lungs, and you should report it to a nurse immediately. Last tip I would give is just make sure you monitor them when they are walking. A lot of times shortness of breath can cause people to be lightheaded, so if they are standing up or walking somewhere and they are shortness of breath, it can be due to not having a lot of oxygen flowing through their system. They can end up fainting. So making sure that you stand by their side, assist them when they are standing up or walking anywhere, because this can be very dangerous. And like I was mentioning before in the tips, if you notice anything outside the normal range for the respiratory rate, and you notice audible like wheezing or they're looking a little lightheaded, you should report all those signs to the nurse immediately so we can update any care plans that they may be on and make sure they have a safety. And lastly, we're going to just talk about healthy lifestyle teaching. So with asthma, it's hard to get the physical exercise in a lot of the time. So finding ways where you can still exercise and not have a lot of shortness of breath could be doing yoga, doing minimal movements in your body that can still help work out your body overall. Diet is very important as well too, because what you eat will affect your lungs and the inflammation that occurs there. Making sure they're not smoking is a key factor as well, and looking at their oxygen levels if they are using an oxygen tank. This could very much help with the asthma conditions overall. Also, it's very important that if they are taking an inhaler or they're on medications for their lungs, that they stay consistent with that so they don't have any flare-ups, which can cause an asthma attack, which could lead to death if they don't have enough oxygen flowing through their system. And making sure they follow with doctor appointments and see their doctor regularly if they do have asthma. As for elderly patients, they're going to need a lot more oxygen or a lot more support when it comes to doing physical needs. So having your lungs be in optimal health is very important for every average day of living.